ADHD and personal hygiene can be a bit of a minefield. And I am keen to stress that having ADHD doesn't mean you're the smelly kid. It means you're at greater risk of being the smelly kid. My name's Heather and I'm a late diagnosed ADHDer, and I want to help make life easier for those of you in a similar boat because I had to go it alone and I don't think anyone else should have to. Personal hygiene is endlessly repetitive. It almost never gives you a hit of dopamine, and it's all about intense sensory transition. And then your evening routine lands right when your meds have worn off, which is not good news. Take brushing your teeth. 2 minutes of standing still doing nothing with a strong mint flavour and a buzzing brush when all you wanted to do was go from the sofa to your bed. You weren't looking for a chore in between. The best you're going to get out of me on some nights is a mouthwash swivel. Or take the shower. It isn't one task, it's many. Towel, undress, water on, find a podcast, don't drop your phone in, get wet, get lathered, get dry, sit on the side of the bath and stare into space. Your brain resists every single transition, so you glitch outside the door until you finally convince yourself it's worth it. Skincare is the same story. You buy the 10-step routine mid-hyperfocus, do it religiously for 2 weeks and then never touch those potion bottles again. So you're back to a makeup wipe or water or nothing for months. The serums are judging you. And even your bedding can't get lost in this. Your brain doesn't track time. So I changed these a few days ago. Turns out to mean 3 weeks. Sometimes you just buy a whole new set of bedding so it feels like a treat instead of admitting how long it's actually been. And then there's the picking. Nail, skin, scalp, you name it. Sometimes you clock you're doing it, sometimes you don't, until one rough edge sends you into an emergency grooming session that cannot wait. Hygiene carries some of the heaviest shame of anything ADHD touches because we're told it's just basic adult willpower, and it isn't. It's dopamine and task switching working against you at exactly the times of the day you've got the least left in the tank. So if any of this sounds familiar, you're not lazy and you're not disgusting. Dry shampoo, face wipes next to the bed, make sure you have mouthwash with fluoride in it, keep your emergency stash in your bag, work with the brain you've got, not the one everyone assumes you should have. And follow along for more ADHD musings. And if you're about to leave a comment telling folks with ADHD to just wash and stop being lazy, save those pearls of wisdom for another comment sections because you're just wasting your time here and you're not welcome.